Dr. Odoms-Young is the Nancy Schlegel Meinig Professor of Maternal and Child Nutrition in the Department of Nutritional Sciences and Human Ecology. We are thrilled that she joined us about 4 years ago from Chicago. She's also a human ecology alum, where she got her PhD in nutritional sciences in the college, so we're thrilled to have her back. She's an expert on food justice, access to food, and equitable access to healthy foods for all of our communities. And she's really focused on partnering with communities to address those critical issues. Dr. Odoms-Young recently served as vice chair for the National Dietary Guidelines panel that recommends dietary guidance for all Americans. And that's, you can imagine how her expertise focused on community, access, and justice was critical to those types of guidelines. That was new in that national panel, and she brought that important expertise. She leads our FNEP program that she'll be talking with you about today, and she is the perfect person to be leading this program, which is all over the entire state of New York, everywhere in New York City, where we partner with communities to ensure equitable access to healthy foods. So it is my great pleasure to introduce my fabulous colleague, Dr. Angela Odoms-Young.
Thank you so much, Rachel. It really has been a pleasure returning to Cornell. As Rachel mentioned, I graduated in 1999, and I did an extension internship for about a week. I came down to New York City because I started out in nutritional biochemistry, and I really, at that time, believe it or not, of all of the community work that I've been doing over the past 2 decades, I didn't know anything about community. I actually started out working with rats. So I needed some community experience, and I came down and I did an extension internship. Eventually, still in my PhD program, I went to work at the health department in Rochester and Monroe County. And so I've continued to just become more my work has been more in depth within the community and partnership with community. I really do have the philosophy that community should lead. People are not, they can partner with us. I hate to say they don't need us, but we really need each other. But really, community should be in the lead to address issues that face their community. And so I'm really excited to talk about FNEP. I wasn't here 55 years ago. Actually, I was 55 years ago, just a baby. And so really, I want to start out with talking about the history of the program and really its roots in New York City, and then really think more about those middle years and some of the trends that have happened, and then where are we going in the future? What do I really see as a pathway forward? Because we have new issues and we have some of the same issues, honestly. And as Tony mentioned, the idea of just continuing to persist to do this work, no matter the context or the setting. So as was mentioned, I'm the Nancy Schlegel Meinig Associate Professor of Maternal and Child Health. This is a picture of many of our New York staff that are here. And at the end, I'm gonna really open it up for us to have a discussion and hear from the staff that are working really boots on the ground with families and doing transformational work. So I'm going to go through just discussing some of the background, what's happening currently, challenges and opportunities in the future. I think Carly so eloquently did the land acknowledgement with Cornell being located on the traditional homelands of the Guyacono, which are members of the Haudenosaunee Confederacy. So we have audience participation. Are you ready? Name that year. You know when Cornell Cooperative Extension was founded? (1894). We were actually founded even before the Smith-Lever Act. Human ecology, Rachel gave my quiz away with 1925. And then, believe it or not, DNS was founded after FNEP. So FNEP was a key component and program within the college overall of human ecology. So who knows about WIC? When was WIC founded? When did WIC start? Actually, 1972. So WIC is after FNEP. So the WIC program, FNEP is really, when they say that FNEP is the oldest program, when USDA says that, nutrition education program, really among all of the food assistance programs included, FNEP was there at the early years. What about Medicaid? I know we're Medicaid. 65. So a lot of action was happening between, actually they started to pilot FNEP in 1964. So 64 to 68, and then it was signed into policy in 68. A lot of this happened around the White House conference, and we just had a recent White House conference to honor sort of that 50-year legacy. But 1969, so around this time where a lot of the other programs came out of the White House conference, FNEP was there to help inform the White House conference, that first White House conference. SNAP-Ed. SNAP-Ed is a larger program, but really it didn't come along until 1992. The National School Lunch Program, although it was, it originated in 1946, a lot of the expansion happened in 1968 when we added free and reduced. And then food stamps, although we think about the early years of food stamps before it became a national program, it came about in 1964. So FNEP was really founded right along when we think about that expansion of our national programs, including the food stamp program. And then what about these folks? Do you remember? Saturday Night Live, the 50th year, which they've been talking about. But Saturday Night Live, of course, after FNEP. So what is FNEP? FNEP is a federally funded initiative that I mentioned was launched in 1969 with that pilot between 1964 and 1968. It really was to assist low resource families and youth in getting the knowledge that they needed to live a healthier life. So we talk about knowledge, attitudes, but what's particularly unique, and I think in the early program, which was really one-on-one. People went in homes and they worked with homemakers to develop not only knowledge, but also skill. So if you could imagine FNEP educators being in someone's kitchen, working alongside that homemaker to teach cooking skills, food safety. So it was really an intimate program where FNEP educators served as a resource in home. We actually do still have some educators across the state that do one-on-one education, although most education now is within groups. It's delivered through the land grant system, what they call 1862s. We're 1862, and we're the only Ivy land grant. And when I go out and I speak about Cornell, both to people that are familiar with the land grant system and are not, really that's something that Cornell is very proud of when we have cows and we have human ecology with Rachel leading this idea of the land grant being an Ivy land grant where people can learn about what's happening in community and students can engage in community work. So FNEP was founded really when we think about the poverty levels, and this is sort of hard to see, but about 20%, this is actually, maybe I'll just get a little closer with a mic. So can you hear me? Yeah. Okay. So I think this is really important because this indicates two things. Of all persons, it was about 26%. The poverty rate. So as part of this program was part of that war on poverty. But you see this huge gap. This is what the Negro, which was of course what was the label of that time. And then also white females. So this idea to go into urban areas and also in our rural communities to do education and work alongside homemakers to improve these outcomes and address the impact of poverty. So it was designed to complement these other programs in focusing on practical skills, including budgeting. So Lyndon B. Johnson authorized $10 million in 1968, and then they had a pilot program starting with Alabama. And then New York was there in those early years. It was a 5-year project for them to look at how could they reach and teach. So leveraging the knowledge and power of research within universities and put that into action in partnership with community. And that's what we still do today. To develop and test educational materials. We have tons. We didn't have the internet, of course. So we think now we have so much education and information at our fingertips. But in 1968, we didn't have that information. And so FNEP educators took the information into people's homes, into their communities, and it used what's called the paraprofessional model, which we still use today, really taking people from communities and keeping them in their communities, but being able to do training and leveraging, again, that partnership between research and action and indigenous knowledge to make transformational change. So the idea was that low socioeconomic homemakers or low resource audiences could be trained and they could understand what they learned, and that a lot of those program participants would then go into communities and educate. It also was a program that's different from some of the other programs like Medicaid and the school lunch program. Although school lunch program, they do hire people from the community, but the idea is to be an economic engine outside of just those traditional institutions like schools or healthcare. So one of the things that is pretty striking when you think about FNEP is that it's not only educating people, but the idea is to be an economic engine by funding people in communities, employing people in communities, what we still do today. But I'm going to talk a little bit about some of the challenges to that because of the decline in FNEP over time. Funding. So this is Nilda, and this is, and again, I'm going to go over here now. So it's sort of hard to see, but this is the East Harlem Nutrition Education Program. And this was really the foundation. Mary Morrison was the first director of FNEP in the College of Human Ecology. And Nilda, who came to the 55th year in Queens, was early on one of the leaders within this program. And this is Jean Bowring, who ended up ending her career at Syracuse. But this very early program, which was the East Harlem Nutrition Education Program, became the foundation for FNEP. And New York was really there in the beginning, helping set the foundation for the program. This is a list of people that, including Carol, which is sort of hard to see, in the 70s, in the early advisory of the program. And I wanted to show a video that just really talks about, it was done at the 40th year, but right before me, Jamie Dolahite, which was a professor when I was a graduate student in Cornell DNS, Muriel Brink, a lot of the people, Joan, who was here right before me, Mary Morrison, as I mentioned. But one of the things that happened within the division, when that partnership between the Division of Nutritional Sciences and the College of Human Ecology and the community was very, very tight. So this idea that the university is down in Ithaca and the other programs are around the state, again, before internet, people drove to programs. People from different counties drove to campus to have that partnership. And as I mentioned, Mary Morrison, one of the professors that was here in DNS, or I guess pre-DNS, worked with Harlem, and community partners were always at the table in addition to Extension. So I just want to show a quick video.
When FNEP first started, it was focused primarily on working with individuals in the home.
We live in upstate New York in a rural county. What it means is that we reach out to people that are sort of isolated, not a lot of public transportation, much of an agricultural community, you know, not a lot of jobs, that kind of thing. So we're reaching out to young families throughout the county. We do more home visits just because of the nature of where people are at and they don't have transportation. So by us going out to those homes, we can reach them where they're at. It's hard. We love to get groups and we want to work with more, but we find that a majority of our work is done on a one-on-one basis.
In New York City, which is where I had most of my experience, all of my experience, the FNEP program operates primarily in groups. And that was a change that occurred somewhere in the early mid-70s. Because Extension was not recognized in New York City, there was very small presence of both Cornell and Cooperative Extension. We had to reach out to other agencies. And I think that's the biggest change that we made in the 70s, is to collaborate with other agencies. And as a result of that collaboration, it enabled us to do more group work. So we collaborated with daycare centers, with Head Start, with clinics. We would go to clinics, and we would do workshops in clinics. We would work anywhere there was a group, we would go.
I think one of the benefits that I've noticed over the years is we do seem to have more local community collaborations with other agencies, which is better than when we started, when we were just knocking on doors and really beating the pavement. I mean, that piece of it is, there's a lot of beauty to that.
Well, everything we do in Cooperative Extension is through partnerships. There's almost very little that we can do by ourselves because our work is so much associated with delivering education to communities. And to reach the community, we have to partner with many of the agencies, organizations, or systems that are already in the community. So we do that by connecting with them through schools, you know, Head Start programs, daycare centers, after-school programs, senior centers. We connect directly with them, and we offer our services to them for the people who they serve. And then also we do it on a statewide level, and also we are partners on a national level with a number of different kinds of organized, formal partnership groups. And that is the primary way that we work, through partners.
The collaborations with agencies are critical. Working with our community partners, resources are limited. We all have to extend what each other has. And so when we can help another agency with referrals or whatever, and vice versa, we can help train their staff, they help train ours.
This is what collaborative efforts do. When 2-3 people put their heads together, something great can happen. And I really think that that's why this is important, for us to continue to work together, for us to continue to collaborate and partner in programs and services that are going to be, in the long run, benefiting our communities.
So really, when we think about FNEP, it's the hands and feet of the division. Out in communities, Tina, who is in Tompkins, still is an FNEP educator. I don't know how long has Tina been an educator for, like many years, but this video was the 40th year. And so when we think about FNEP, again, that idea of the hands and feet has to have a scientific backing. And the leadership within FNEP really took that on to help establish a part of that national program. So this is from the East Harlem nutrition program, a paper that was published in SNEB in the 70s. So the role of FNEP aids in improving the diet of pregnant women, how FNEP helps people case studies. So the idea to disseminate. And Jamie, who really did very groundbreaking work about how every dollar of FNEP really saves $10. And that's used nationally as a statistic and to advocate for funding for the program. And Muriel Brink, as you see on this article, that wrote about FNEP, an investment in the future. So Cornell was at the table at the national level as the program was being developed. So right now, again, the program is administered out of the Division of Nutritional Sciences to disseminate science-based knowledge. And I want to talk about where we are right now and how things have changed. This is our organizational chart. Alicia and Annette are here. Michelle is online, and Sarah is online. And then we have other regional nutritionists that work at the state level. And then at the end, I'm going to turn it over to our New York City staff to talk a lot, since we have people, and we're here in New York City, which I'm very excited about, to talk about how the program is administered in New York City, which is our largest program across the state. So we have active engagement of fun activities, because you really can't teach nutrition unless it's fun. Hands-on learning, really thinking about demonstrations. So having action-oriented education, evidence-based action-oriented education. What is also unique about FNEP is the idea that people graduate. We still use that early model where participants have to engage in a minimum number of sessions, and then they graduate. Those certificates, and I'll ask that our New York City staff, because I've heard people, educators, talk about what happens when a participant gets a certificate and how they use that certificate. So we have 567 partnerships with WIC, Head Start, places of worship, food stores, health clinics, and libraries. And FNEP is evidence-based in the sense that it shows behavior change. About 97% of those that receive education report changes in dietary quality. We still use a 24-hour recall model, which hopefully will change at some time so that we can have quick assessments now that we have more evidence-based assessments. But we also use a behavioral checklist. Food resource management is part of that. So about 92%. Physical activity, food safety, and then food security, which again has a lot of external challenges that we hope to address. So this is a quote from a single mother in Queens that attended FNEP classes. Now I cook meals with my daughter at home. We eat fast food only 2 times a month instead of every day. We lost weight. We're changing our eating habits. We're playing games, drinking water instead of juice. So FNEP nationally, as I mentioned, we're part of a huge network of 1862s, and then now what's called 1890s, historically Black colleges and universities. 76 land-grant universities conduct FNEP and reach about 500,000 low-income youth and about 200,000 low-income adults. 80% of the families report being below the poverty level, and about 70% of the participants are people of color, and this is nationally. But we've seen some challenges, and this is the national program of funding. You see that decline. So over time, from 1999, this is from 1999 to 2025, which is estimated. So we've seen that decline in national funding, so we had a decline in associations. So FNEP used to be in every association almost across the state. Now we have 14 associations in 16 counties, and that includes the 5 boroughs. Adults and youth enrolled, again, we continue to persist. We had a decline during COVID, which is now going back up, but you see that trend based on funding, we're serving fewer people. And part of the reason why we're serving fewer people is because we have fewer staff. And when the program, 1999, of course, wasn't the 60s, you started to see a decline in national funding in the 80s. And so again, we're doing less, trying to do more with little, but that also presents an opportunity to think about new models of delivery, other ways that we can have support, other ways that we can work in partnership with communities. So we've seen a decline in both professional staff and paraprofessional staff. And really our paraprofessional staff, I love our professional staff, of course, but our paraprofessional staff is really, again, program participants in many cases that become a part of the organization and are leaders within the community. And we've had a decline in our paraprofessional staff. One of the things that we talked about as far as the paraprofessional staff is that my work over time has been about economic equity. And it's so important as I go out and talk about economic equity that we pay a living wage. And so the goal is to think about how with paraprofessional staff with fewer dollars that we can think about, we want people to be able to be economically viable because we're working closely with communities and we value that knowledge. And so again, how do we think differently about these models? Challenges, series of lessons delivered. Again, we used to have many lessons delivered, and I'm going to show a chart. Nobody now is going to participate in 30 lessons. They have people who participate in 30 lessons, again, because paraprofessionals would go in homes and you would show up every day, week, and now we have about a mean number of 7 lessons. And again, evidence-based curriculum are used, but we have to think about the future. What do people, I don't see anybody with phones out, but what do? Our phones are really connected to us. How do FNEP, how do we use technology? How do we reach more diverse and underserved populations? We have a diversity of populations that are happening within communities, and we need to think about how do we serve? We have a lot of FNEP educators that speak a variety of languages at sites. Upstate, unfortunately, we don't have that diversity, although we have a diversity of participants in upstate that we need to reach. Securing consistent funding for program expansion. Well, we have opportunities. I don't want to be the bearer of bad news. We gotta be enthusiastic. Again, Cornell is a leader in the industry of nutrition education and nutritional sciences. How do we leverage partnerships? How do we incorporate culturally relevant curricula? One of the issues that we're facing right now is translating curricula into multiple languages. And part of that is linked to co-design. How do we co-design curricula with communities? There is a best practice that curricula should actually be developed in the language that is going to be delivered, not translated. Although we need to translate some materials, really the standard that we know now is that if it's going to be delivered in Spanish, it needs to be developed in Spanish. So part of that is thinking, more with innovative co-design and partnerships and using virtual platforms, which with COVID, we saw that we needed to make a bigger adjustment and figure out how to do that. So what's next? We're in 14 counties. We were in every county. Honestly, how do we get back to that? That's a goal, is to be in every county across the state. Strengthen data collection. We're evidence-based. We have to really base it in the science and have strong data because that also speaks to how our program is effective. We have other things that's happening in DNS. We have a Center for Precision Nutrition. We have all of these things that are emerging. We also, in addition to FNEP, have a research lab that's focused on the social and structural determinants of health. So how do we bring these things together to more effectively deliver education within communities? And again, thinking about virtual platforms and tools and joining other public health initiatives. So just in summary, and then I'm going to turn it over to our FNEP staff that's here in New York City. We launched in 1969. We expanded to youth programming in 1970s and 80s. 1990, we started to realize technology was needed. We strengthened a focus on disparities. And now we're thinking about how do we make sure everybody gets FNEP? Everybody needs FNEP. Of course, I may be a little biased, but everybody needs FNEP. We need to make sure that these tools and interventions, particularly at this critical point, as Rachel mentioned, I was vice chair of the dietary guidelines. I was also able to attend the White House conference, which focuses on food and nutrition security. We're moving beyond food security, which is having enough food, to nutrition security, making sure we have culturally adequate, nutritious food that's readily accessible, and that we also have the education to make sure that people are able to put that food that they receive or that they purchase in action. We have food as medicine emerging. Where do our educators fit within that to be part of the food as medicine movement? Because we've been doing this a long time. And so I'm going to turn it over and then we'll open it up for questions. But we've had 5 decades of transformative education and play a critical role. So I'm going to start and just see who wants to come up. I won't. It's by choice, right? Voice by choice. We go by voice by choice. So I won't call on anybody because it's voice by choice. And we want to make sure that those that want to be heard are heard and share their story. No, it's funny because I've been out in the community and our staff is not shy at all.
One thing that Cornell teaches is not to be shy to talk in front anybody. We can do it all the time. Hello, my dear. My name is Sandra Guzman, and like Ms. Autumn is saying, it's like I started like she was saying. One summer for me, it was saying I attend the program. And that time we didn't have parent coordinators. We have the teachers working with the parents. And I was doing the nutrition workshop, and then she said, you know, they have openings. So do you want to work? It's just for the summer, this summer. And I said, okay, let me try. So I went, and one thing that I didn't thought about that it was good, it was that I went at 3 o'clock for an interview, and I said, oh my God, 3 o'clock, I am an early person. I will be there at 7:45 to be at 8 o'clock meeting. But I went at 3 o'clock, and then was Carol. And Carol said, well, you know, can you start working on Friday? It was Wednesday. And I said, oh my God, yes, I can. I'm just gonna look for a babysitter for my son. I went with my eyes closed and everything. And that was one summer. And now it's almost 28 summers after. So this is something that I'm very proud, because I reached so many families that if we start the first day that we start our groups, writing the names, just the first name, because we cannot share all the information, just the name of the participant that we do, I will have, I don't know how many books or pages of names in there, because it's so many pages that we have been reaching out parents, children, and all of that. So it's being a big, nice working with the communities, because like you were saying before, we are the community. We came from the community, and we understand that community, and we work with them with all our heart, and we give them all. So this is the story that I can share with you, and this program is being amazing, and I hope they continue. And like you were saying, maybe balancing staff, paid, and balance and paid and everything else, because things have changed, and we are working for the better. And since pandemic, let me tell you, we were saying before, 1 year before we said, well, maybe we can do program on the internet. And we said, no way. We cannot do that program on the internet because that is nothing. We love to see people, we touch people, we hug people, we learn with people. But let me tell you, it's been an amazing road to do on that platform. It will open the doors for us to go to people that couldn't get to the schools because we reached them at 6, 7 o'clock in the night. And we were prepared for them and they learned so much. And we still, until now, I still keep in touch with some of those participants that starting at the beginning of the pandemic. And all of us, I think so I can talk for me, but talk for all of our community educators that we all do that. So thank you for listening in. Thank you, thank you, thank you.
Anybody else? Voice by choice.
I'm Gligor Toskovich, class of 87. I'd like to ask the elephant in the room question, if I may. The incoming president has said he's going to cut the SNAP program. Would you care to address that and its impact on FNET and what you do?
Yeah, I think it's interesting that you mentioned that because I started, as I mentioned, I graduated from Cornell in 1999 with a PhD and shifted over to community nutrition. There have been so many discussions along the time of my career about cuts to SNAP, about cuts to WIC. You know, FNEP has continued to persist during those times and really work closely with participants. When we have cuts, or like there was a time, believe it or not, WIC is not an entitlement program. And there was a time, now everybody has access to WIC and we have lower participation. But there was a time actually that we had higher participation where there had to be some priorities made and who was served and how they were served. That happened for a very short time. But I think during all of the times, although the new president has talked about the idea of SNAP cuts, we have been here before in those conversations. And I think part of it is to just continue to innovate, because when people have fewer resources, they need more support. This is how the charitable food system emerged, really in the wake of a reduction in our programs, or thinking about a reduction in a gap that we needed to fill. And partly FNEP has continued with that education. How do you use resources more effectively? Because food resource management is critical, when you don't have a lot of resources. And so our educators become even more important. Hopefully they don't cut FNEP, honestly. I'm not a fan. I am a very big fan of SNAP. I work with WIC collaborations. I came from Illinois, very closely with our state, work with the National WIC Association. And our federal food and nutrition assistance programs are essential. You can't educate your way out of not having enough food. We need both. And so I think it's important that we advocate that we need adequate funding for SNAP and that it doesn't get cut. It also helps our farmers. SNAP is called the great multiplier. It helps our farmers, it helps retailers, it helps people in communities. But if, and hopefully it won't be the case, we have to continue to advocate for SNAP. You know, that's just my personal opinion. Not Cornell's opinion, based on my, academic experience. But it's really important that we continue to have those federal assistance programs receive adequate funding. It makes the work of FNEP easier when people are resourced. But even when they're not resourced, hopefully we will be here to work with communities to help support them. In their homes, in some cases, and in their communities. But I'm glad you raised that point because that's critical. We had SNAP expansion under the last administration because of the Thrifty Food Plan. realizing that maybe potentially SNAP as it stood was not adequate and that we needed some expansion for people to eat healthier diets. But a cut would be very detrimental, honestly. There's a lot of modeling that economists have done as it related to that. Thank you so much for that.
So we have reached our Q&A section. So for the folks who are online, please put your questions in the chat. We have someone in the room monitoring. If you are here in person, as we just had a question, please raise your hand and I'll come around with the mic for folks.
And Monica has her hand.
Yeah, we don't have the technology to like have a Zoom interface, but please, Monica, put your question in the chat and we will get to it. But we have another question over here while that happens.
Hi, everyone. My name is Joseph Nelzi, class of 2018, human ecology, actually. So thank you so much for hosting this, actually. I'm seeing a lot of familiar faces in here. I was part of the Purpose Lab for about 4 years at Cornell. Just like really excited to be here. Just wanted to say thank you again for providing this. So I'm recently a co-founder of a baby formula startup, which just got funded actually last month. Our goal is to actually... Thank you so much. Yeah, our goal is to actually provide like healthy and affordable formula for parents. So it's just very nice to see like the work that EFNEP have been doing for the community. And we would just, I would just love to connect with you after this to just like learn more about how we connect more.
Yeah,
But
that
thank
would
you
be
again.
great. There's, you know, all of the action that's happening right now
Yeah.
around infant formula. So
Yeah, we're actually working with Cornell COE as well and Stanford Nutrition program as well to aim to bring a formula plant in New York State as well. So just really excited for this and really thank you for putting this together as well.
We have some questions from online and then we'll get back to the people in the room.
So this is a question from one of our viewers that are referring to the slide about the challenges in professional staff. They ask, does the funding decline include changes in inflation? If not, I imagine the reduction in purchasing power could be greater.
you said changes in?
The slide about changes and professional staff.
That's a good question. It does well, and I know Michelle is in there. She does the budgeting, which you can't talk on Zoom. When we do the budgets, we use the similar Cornell funding, but it doesn't really account for inflation in the way that the decline has been. So there's how much money we get, then we have to support our campus staff, and then each of the counties submit budgets for those staff. And really more we think about, and I'm looking at Jan, the idea of the cost of living increase to try to adjust for that. But we don't get more money, so the money has declined. So we kind of work within what we have. We want to make sure that people do have a cost of living increase. And honestly, what's probably going to happen in the future is that as people retire, we may end up having a smaller team because of the idea of having a living wage and making sure people get a cost of living increase. So what does that mean? No, everybody will, of course, be employed. We don't want, but there will be people that retire. And the question is how do we structure our staff? We have two things that are happening that I'll say really quickly. Alicia, who is our upstate associate director, and then we're hiring a downstate associate director. So the idea is to figure out, again, how we can think strategically, because we can partner too. We already partner, but again, there's a lot of opportunities because our educators are superior. And we know that everybody needs the education. There's a lot of action happening. When I go to meeting, then I'll keep it short, But I've gone to like, when these people talk about healthcare, they're like, we need to make sure we have nutrition educators. I'm like, we got nutrition educators. We need to teach people cooking. We've been teaching people cooking to cook for 55 years. So part of this is when we think about opportunities for how we can engage in some of the things that are happening now, and the discussions is critically important because, as was mentioned, the idea is that we are the community. Our educators are the community. And what better instructor than you could have? I have a PhD in nutrition, you know what I mean? Like, but I am, I worked in the community, but do we need professors? We do need physicians to a certain extent, but they need to partner with paraprofessionals. So the idea that we always need paraprofessionals at the table to lead within communities and be in communities. So yes, that's a long story, long response, but it doesn't account for inflation, which.
Hi, I have a question. So maybe you covered this, but I was curious in like the funding mechanism, if it's all federal, is Cornell like contributing a part like within their budget? Because when I'm thinking about all the FNEP staff that you have, and like even when I had my child, I actually took the nutrition course. And so a lot of it, I know the wage, I know what it is like to live in New York City. You have a lot of staff in the city. Inflation is going up, prices are going up. What does it mean when you have staff members teaching this curriculum, but also utilizing SNAP and WIC, and dependent upon NYCHA to even make it when you're working for an Ivy League institute?
So our counties do provide support, a lot of administrative support. Early on, when I was reading some of the documents in the archives, county governments put in funding, not just extension, but county governments and others, they put in funding. We have our own Smith Lever. So where Smith Lever broadly is more of a pool, we have a Smith Lever that's specifically for FNEP, but the counties do kick in a lot to support from administration, supervision. But again, you hit it right on. I would love to see an increase at the federal level. We have phenomenal federal leadership. Helen Chipman, who has been in FNEP, for so many years, is retiring, and Corinthia Cherry is going to be the new director. A person that's coming in has a lot of experience in FNEP, but it is one of those programs, and some people are like, FNEP is the best kept secret. We don't want it to be the best kept secret. So we need to think at the federal level, but again, how can we think about state support and more, other support, but the counties do kick in as far as supporting with funding as when it comes to administration staff, infrastructure. So the directors have been phenomenal. Those that have the program right now are very supportive of the program and staff. And so we just have to honestly figure out how we leverage more resources to support those educators in doing good work.
Good afternoon, Yuri Pollock, Human Ecology class of 2001. Just wanted to get your thoughts in terms of the role. So we talked a lot about the role of the federal government. In terms of local government, for some of us like myself who have worked closely in city government or around city government, in speaking about behavioral change and eating healthy, what can city government do to help promote that? I know that, 10 years ago, I think there was a discussion about sugary sweetened beverages and whether there should be a tax there. Conversation about food deserts and lack of access to healthy food. What are your thoughts on kind of how city government can be a partner in this work?
So I think that that's critical. What we know, again, you hit two issues, sugar sweetened beverages. I don't know if you all saw the front of pack. FDA just released a discussion about the definition of healthy, what's going to go on the front of pack as far as the front of pack label. And so being able to partner, communities partner with educators, that's critically important. I think one of the things that state government and local, like city government, can do, we do receive federal funding. So we deliver the program through those USDA dollars. And many times I've seen programs, this is like across the country, not just in New York State, that there'll be nutrition initiatives. But the idea is that there are some programs that are already funded. And so what we need to do is develop new programs. And I think what we need to do is we need to figure out how to partner with those existing programs to either support more staff or support the infrastructure and get more bang for your buck. And having those partnerships between, like in Chicago, I used to work with the health department, again, as I mentioned, WIC. The idea is to have partnerships between Extension and WIC, partnerships between the health department. We have a project where I'm working with some student veterans, and the VA has been very interested in food insecurity. How can we think about the idea of any of these programs that we have or offices that we have that operate locally to partner with programs that are already existing that may be funded but could use a boost, and to think about how to supplement that. That to me is the best model because we have experienced educators. And what happens is, and I've seen it over the years, we do really good training, not just at Cornell Cooperative Extension, although we do really good training at Cornell Cooperative Extension. But what happens when that salary is not enough? Those other programs actually benefit from the training of Extension. Those folks, supervisors, educators, they already have gained that experience. And so they will, can apply to some of these other initiatives, PSE initiatives that come about. But we should try to support those programs where people are. A lot of times people want to stay where they are in those programs that they're working in. So how do we continue? Because I know it's voice by choice, but just like yelling out, how long have you worked in FNEP? 15 years, 12 years, 16 years, 28 years, 1 year, yeah. Tabby, oh wow, yeah.
20 plus years.
20 plus years, 15 years. 3 months, because I was gonna say, so retaining that, and I think partnering with cities and states are critical. I think the other thing is the gap of where we can't do a lot of navigation, like getting people to programs. PSC is in SNAP-Ed, but it's emerging in FNEP. It has been probably over many years of how do we do PSC, policy systems and environmental change strategies. So I think partnering with local governments is critical. And I know Cornell partners with a lot of local governments across the state. And then how do we deepen that relationship?
We're going to take one more question from online, and then we're going to move to lunch.
So this question is very much related to the government question or the policies, but with a specific example. Food as medicine is gaining traction across the country. What challenges do you expect in integrating the food as medicine framework into food-focused policy and programs? And what are some advantages you imagine the food as medicine framework can bring to those spaces?
Mm-hmm. So the food as medicine framework is critically important. One of the things that I think we forget is that food is in all sectors. So the biggest sector that's similar to healthcare is schools. There's so much, meals that happen through childcare happen in schools. We don't think about schools as meal programs, although over time, a lot of the meals that how we reach people in through, like, for example, school lunch has nutrition standards. and then they're implemented to make sure we do have some adequate diets that youth receive. I think the same with medicine. Food is Medicine has really the potential to shift funding into prevention and into treatments like medical nutrition therapy that are critical for disease management. We have such a large chronic disease prevalence in the United States, diabetes, cardiovascular disease. There's a big focus on training physicians. We always had a workforce of dietitians that we need to make sure are included in that conversation. So I think there may be some challenges in implementation and really with the Medicaid waivers that are happening. I know that there's extension conversations of how extension can be involved in that, but it's important that the Food is Medicine movement also looks at the lessons learned from these programs that have been in existence, for several decades, to how they can maximize those lessons learned in clinical care, but also involve the folks that have been boots on the ground in those initiatives. I think there will be, I don't know what's going to happen, honestly. I'm more familiar with what happened in the old administration. Again, I think most of us are. We don't know what's going to happen with the new administration, but they've had so many Food is Medicine sessions and discussions and policies. And so I really think about food as health. Food to me is everything, is more than medicine. But we have the opportunity within healthcare to think about food as medicine. We need to think about food, honestly, in all policies.
Thank you so much, Dr. Odoms-Young. Thank you.